I remember sitting in my car right after leaving his office, telling my wife what the diagnosis was, that I'd been diagnosed with melanoma, and I had to run over immediately to get the tests at the hospital. She didn't understand what the severity of it, and nor did I, but the panic that the doctor seemed to have and the urgency in getting those tests was very scary. Since the original diagnosis, so since December of '06, I've lived in increments of 3 to 6 months and have been hesitant to make plans beyond that. A new pair of shoes, a new shirt, planning a trip. In May of 2012, I looked clear, the CT scans were clear up until that point, and then May of 2012, CT scan showed numerous tumors in my right lung and surrounding area. And so at that point, I was put on the IPI, which has been miraculous for me. I told Dr. Kreisel the other day that I felt like I was pushing the envelope, that I still was doing okay after a year and a half, and he told me that he has a patient that's doing well after 3 years. So the IPI is the hope that I have in the event I needed it again, and I assume that I will. And also, I can't remember how many people have told me that, well, because of your experience, I've gone to the dermatologist, I had this spot that I was worried about. So, there's that positive as well. And I think another point, though, is also that if you don't feel good about something, get it checked out. Yeah. Had I not insisted that lump be removed, I'd be dead. When you have cancer, you basically have an identity of being cancer. And it's a real interesting scenario to be in. There's a lot of assuming going on. There's a lot of ignoring going on. People don't know what to say to you. Sometimes you're invisible to people, and sometimes it's taken for granted that you can't do things that maybe you can. So the cancer thing, it's a real interesting phenomenon. And if you think about, okay, I have a limited amount of time, we all do, I guess, but mine's maybe a little bit more predictable. Well, how are you going to use that time? And what are you going to do with it? What really is important? Or do you want to just be angry and go about your way of, exuding that? And so I like my life. I enjoy my life more now than I ever did. And, you can go either way. You can think, well, I'm a victim. Why me? This is awful. I'm mad, and I'm mad at everybody. Or you can think, I have this day.